Good afternoon, everyone. We're thrilled that you can join us today for our conversation. See some folks popping in on the chat, so it's lovely to hear where you're all coming from and the hellos and the welcomes. We're going to give folks a few minutes to join us, and then we're thrilled to start our conversation presentation. For those of us on the West Coast, it's still good morning. So I'm on the West Coast. So good morning, good afternoon to everyone as they join us for our first Unlocking Democracy meeting for the new cohort and our presentation from Safer Cities for the field to kick us off. Hello, Xavier. We're super excited to have HBCUs be a part of our Unlocking Democracy this go around. So welcome all of our college campus folks. We're really thrilled that you can be here. We've got some staff in Houston. Go Houston. All right, team. Being mindful of everyone's time and our guest presenter, I think we should kick this party off. So if you are part of the upcoming learning community, the learning communities that just applied and just got accepted, we are going to be using Slido later on during the day today. So if you want to scan this now, we'll be after our Safe City presentation and after we have a small break, those that are in Unlocking Democracy 3.0, so the HBCU folks, the youth folks, substance use, and CVI folks, just take a minute right now and scan that QR code or join Slido.com. And after our presentation, we'll be doing some interactive stuff with y'all. Next slide. All right, so how are we spending our time today? We're going to do a quick organizational overview of CSG and CPE. Then we're going to have Sara from Safer Cities do a presentation with some question and answer time. We're going to take a break, and those of you that are joining us that are not a part of the new cohort, you all can enjoy the rest of your day. The new cohort, we're going to take a quick break. We're going to come back. We're going to talk about data connections. We're going to do an overview of the new learning communities. We're going to have a group discussion and then next steps. All right. So this is a partnership. Unlocking Democracy is a partnership between the Council of State Governments Justice Center and the Center for Policing Equity. I work at the Council of State Governments. We are a national nonprofit, nonpartisan organization that really combines the powership of a membership organization to serve all three branches of the government. And our goal is to increase public safety and strengthen communities. And a part of those goals and how we achieve those goals is to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. And how do we do that? We do it like today. We bring people together. We love bringing people together for peer-to-peer learning. We drive the criminal justice field forward with original research. We build momentum for policy change, and we provide expert assistance.
Hi, everyone. My name is Eliana Mendoza, and I am a Senior Community Engagement Coordinator at the Center for Policing Equity, also known as CPE. Next slide. CPE is a racial justice nonprofit dedicated to empowering communities, particularly Black and Brown communities, to transform and improve public safety. Our focus is on creating public safety systems that truly support and protect the people they serve. We do this by using science and data as tools for justice. CPE collects and analyzes data on behaviors within public safety systems, working directly with communities and leaders to redesign public safety systems that meet the specific needs of each community. What is our ultimate goal? It's to make policing less biased, less deadly, and less dominant in people's everyday lives. One of our core beliefs at CPE is that we can forge a path to justice by rethinking what public safety really means and by building systems that are effective, humane, and equitable. Through our data, stories, and deep relationships with communities and leaders, we aim to create change that is bold, innovative, and sustainable. Next slide. So far, our impact, which I'm sure these numbers will definitely jump by the end of the year, since our founding of CPE, we have served over 30 states, worked with over 60 law enforcement agencies, and have impacted over 85 million people in the US. Next slide. Our country is in a critical moment calling for fundamental reimagining of public safety. Law enforcement agencies increasingly recognize the need for systemic change, and many have joined forces with CPE to make that vision a reality. Police departments that partner with us have already adopted one or more of our policy recommendations, taking measurable steps toward building safer and fairer practices. Through collaboration, data-driven insights, and commitment to racial justice, the Center for Policing Equity continues to support communities across the nation in their pursuit of a safer, more for just of all America. We also have our link if you would like to look at any of our white papers or briefs that we have. And now I will turn it over to Sara Yousuf. Sara Yousuf has spent her career focused on making our communities safer. As a lawyer, she has been both a public defender and a prosecutor. She also has a journalism degree from the University of Miami, and prior to helping launch Safer Cities, she produced a short-form social news show focused on crime and safety. Thank you for joining us today, Sara.
Thank you. Again, Sara Yousuf, Safer Cities. We are a media platform that covers innovative public safety solutions, and I'm just so thrilled to be here. Today, I'm going to be talking a little bit about what happens when you call for help in a city. For example, say there's a teenager threatening self-harm locked in a bathroom, or maybe there's somebody that's passed out and blocking the doorway to a local business, or maybe somebody's having an acute mental health crisis and they're in traffic causing a danger to themselves or a danger to other people. In most cities, you call for help and the police respond, which necessarily draws from the limited police capacity that we have and takes police away from the emergencies they're really trained to handle. Once the police arrive on scene, they're in a situation where they have to handle an acute situation that they may not have the training or background or expertise to handle. And if the person experiencing the crisis needs to be taken somewhere, they are often left with two choices, either jails that aren't designed to provide care or emergency rooms that are overcrowded, expensive, and really not set up for long-term treatment. Next slide, please. So how are cities tackling this problem? What are they building instead? Next slide. Cities all around the country are setting up teams of alternative responders. These individuals are trained in things like mental health and substance abuse and conflict resolution. And cities are also building places to take people to receive care. There are beds, places where people can stay and get treatment, things like addiction stabilization units and crisis stabilization centers and sobering centers. And not only can they get longer term treatment, they can also receive a warm handoff to other community-based treatment after they've had their inpatient stay. Cities are also integrating dispatch. So what that means, for example, is in Austin, when you call for help, a trained mental health responder, a trained mental health professional from the MCOT program answers the phone. And they give you the offer of police, fire, or mental health. If the caller determines that it's a mental health concern, the dispatcher will ask a number of questions to determine the risk level. So if there's a weapon or an ongoing threat, they may send a team that includes a police officer, but many times they'll send a team that includes a social worker and a medic, people like mobile crisis responders like Denver, you may know them from like the Denver STAR program or Harris County's HEART program or Oakland's Macro. They're really all around the country, but in Austin it's the MCOT program. And Another great benefit to having mental health professionals in the dispatch center is that they're often able to solve the issue on the phone. Like I mentioned in the example before, if a teenager is threatening self-harm, they may be able to de-escalate the situation and talk the person down and connect them to the kinds of treatments they need immediately. So sometimes they're able to solve the issue by phone and not send any sort of responder. When there's someone that needs to be sent, there's an appropriate responder, the right response for the right problem. So a modern public safety infrastructure really includes that robust ecosystem, integrated emergency call centers, and then special places to go. So someone to respond, someone to call, and somewhere to go. Next slide, please. A key component of the modern public safety infrastructure is this idea of a community safety department. And the fullest, most built out example we have in the country is Albuquerque Community Safety. But the core idea is that they centralize and coordinate all of a city's unarmed first responder services. So the armed first response is the police, and there are also fire and EMS first responders, but community safety department houses all of the other services, violence intervention, mobile crisis response, overdose response, and many others. And it has the divisions like a police department might have a robbery division or a homicide division or a sex crimes division. A community safety department will have all of these different teams, including things like civilian parking enforcement or clean teams who do things like pick up drug paraphernalia in public spaces. So a modern public safety infrastructure really involves all of these core ideas. Next slide, please. So here we have a sketch that we made of what a modern public safety infrastructure might look like in the context of a local government. And no one city is doing all of these things, but all of these things exist in different places around the country. So we didn't make this up from nowhere. This is really based on what's happening and what we're seeing and what we're reporting on. So I want to start just with the Central Dispatch Authority. You can see that it houses all of the access points to an emergency response. So it houses the 988, the 911, and the 311 access points. And you can see that they're also integrated in one agency. So they're not separate numbers going to separate agencies. From there, the Central Dispatch Authority, when you call for help, will then designate the appropriate first responder agency. We all know about the police and how they have the training and the mandate to respond to ongoing public safety emergencies and violent crime. But then there are also other first responder agencies. I didn't include EMS and fire right here, but we have the Community Safety Department, and they house all of the unarmed first responder services that cities need for the kinds of problems that we're facing all across the country. First responder agencies also have access to a number of facilities. We're all really familiar with the jail, which is a last resort locked facility to keep people pending trial who currently pose a safety threat. And we're all familiar with the emergency room to provide medical treatment for people in an acute situation. But there's also this umbrella idea of centers for community safety. There are places beyond the jail and beyond the emergency room where people can go to get help. Places like trauma recovery centers for victims of violent crime, sobering centers where people can rest and sober up, but also get connection to and linkage to services in the community, and crisis stabilization units, places where people in mental health crisis can be stabilized and then connected to the kind of aftercare they need to stay well. And cities are also looking into this idea of a community safety innovation coordinator. So these are people, a cabinet level position that works across all of the agencies and pilots programs that can reduce the risk of violence and vulnerability. And it's their job to really research what's happening around the country and pilot programs to make sure that the first responder services are really responsive to the kinds of problems that are happening in that particular community. So this map isn't the entire territory, but it's a rough sketch of what a modern public safety infrastructure can look like. Next slide, please. Here we have just a little bit of a small coverage map we made of some of the programs, some of the pieces of infrastructure that already exist and are already up and running across the country. This is by no means exhaustive. This is just represents about our last year or so of coverage. And you can see that the programs are coming from, you know, they include people to respond, like mobile crisis response, and but also other services, victim services, violence intervention services, safety and transit ambassadors, and many others. So the components to a modern public safety infrastructure, they exist. No one place is doing all the things. And cities across the country are really building up this infrastructure. The energy is building and spreading across the country. Next slide, please. I would love to talk to you all about all of the responder teams that exist, but I just don't have the time. So I want to zero in on one that I think is particularly innovative and important, which is the Community Safety Department that, like we mentioned, houses all of the unarmed responders in a particular city. Cities like Albuquerque are not only centralizing these responses, but they're also putting them as at the same level as police and fire. So they're a co-equal department that sits along the other emergency responder services. Next slide, please. Albuquerque Community Safety is the nation's first community safety department, but there are community safety departments in process underway in other places. So they're working on community safety departments in Durham, North Carolina, Cambridge, Massachusetts, and also in Seattle. What makes a community safety department work? Why do they work? Well, in Albuquerque, they're a part of the city charter that Albuquerque Community Safety be co-equal and be funded and exist to provide these services. But there's more to it. You can see from the photograph that they have a real modern headquarters. They have uniforms. They have a marked vehicle. You can really see that these are public safety positions, and they look and feel and sound like professional public servants who have a role to play in public safety. It's different. It's a different role than the police. It's a different role than firefighters and EMS workers, but it's a really critical role, and it builds out the city's public safety infrastructure. Next slide, please. Thank you. All right. Albuquerque Community Safety is just so interesting because they are the most robust community safety department, and they've been doing it first and longest. So they have a number of divisions, and I don't want to go over each of them, but I do want to just give you a little picture of how they occupy separate spaces. So the mobile crisis team clinicians, they work in a team with uniformed law enforcement. And so they're responding to like the high acuity mental health calls, and they do things like de-escalate. But then there are the behavioral health responders that are, they respond to mental and behavioral health, chronic mental illness conditions, and situations that don't require the police or another responder. There are also the community responders that they support community members like business owners in need of assistance related to things like inebriation, homelessness, minor injuries, incapacitation, abandoned vehicles, a number of problems that exist in communities and don't require a police response. There are also the street outreach and resource responders, and their job is to provide resources and coordinate with city departments to help people who are experiencing homelessness in encampments. The Cora responders are, they work with victims, families, and communities, and they help that people who are impacted by real major tragedies, things like homicide, gun violence, suicides, domestic violence, sexual assault. And they're these trauma-informed responders who come to the scene, educate people on grief and healing, support them through that process, and as well as provide people with access to ongoing services, including things like trauma recovery and that sort of thing. And finally, Albuquerque Community Safety, Scott, they have a violence intervention program, and what they do is focus on the people who are most at risk of becoming part of the cycles of gun violence in the city and intervene with trained conflict resolution experts to stop violence before it happens and really intervene in those cycles. Next slide, please. we really wanted to know what people around the country, not just in New Mexico, think about community safety departments and the services they provide. So we conducted a national survey of 1,704 registered voters. We worked with our partner, Jonathan Chavez at Guidance Research, and he's a really great pollster. He's worked with everyone from the White House to the military to professional sports. So he's got just tremendous experience in public opinion polling. Next slide, please. So we found really high support for community safety departments across party lines. We asked voters, in general, would you support or oppose your city creating a community safety department that would function as a separate and co-equal city department alongside the police and fire departments? And we found 75% net support compared with 16% net oppose. Interestingly, this support crossed party lines. 88% of registered Democrats supported community safety departments and 63% of registered Republicans. So we found that this support really was broad and bipartisan and fairly overwhelming. You rarely see numbers this high in the public safety context. So that was really interesting. Albuquerque Community Safety has, feel free to go to the next slide. Yep, that's great. Albuquerque Community Safety has gotten a lot of press in Albuquerque. The community really knows what Albuquerque Community Safety does. They've diverted many, many calls from the police, and they're really familiar with it. But we wanted to know what happened when people in other parts of the country had a fuller understanding of what a community safety department does. So we wanted to make it concrete for them. So we played them a local news clip that I think did a really, really good job on this. And so we're going to watch it together if I can successfully do the screen share. Give me just one moment.
There is no shame in admitting you're not the best person for a tough job. And sometimes it's really the best outcome for everybody involved. And some would argue that is what has come out of the partnership between Albuquerque Police and the Albuquerque Community Safety Group.
Yeah, and the partnership is designed to free up APD officers so they can handle the most serious crime calls.
Tamara Lopez spent the day looking at some recent data that seems to paint a pretty positive picture here, Tamara. I mean, how beneficial has this been for APD?
Tessa, ACS says it's been able to divert 3% of callouts from APD since its creation. And while that sounds small, it means experts in things like mental health callouts and welfare checks are responding to those calls. And it also frees up a lot of APD officers.
You think about it in any job, right? If someone came along and said, hey, you know that thing that you're either not equipped to or you don't want to deal with? What if I do that for you? You're obviously going to love that person.
Joshua Reeves is a division manager of Albuquerque Community Safety, a group created in 2021 to aid police on callouts.
Our grandmother who called us, and she was concerned about her granddaughter who was addicted to drugs, had been so, and she didn't know how to help her get out of this cycle. And that's not necessarily something that police can really take on and figure out how to navigate for them. And so we're able to said, well, where can we find her? And we're able to take the time to go find her, talk to her.
Since its creation, ACS has taken just over 11,000 calls instead of the Albuquerque Police Department. Calls range from welfare checks to behavioral health issues. From August to October, there were more than 4,000 calls for behavioral health responders. In October, the ACS had the most callouts in District 2, which includes the downtown area with over 400 callouts, and at District 6, which includes the International District with over 300 callouts. Now, Reeves says after reviewing this data, they want to start setting up area command posts to better help those who most need it. In a statement, Chief Harold Medina said the alternative response to nonviolent calls is making a difference in Albuquerque and that ACS is freeing up officers. But ACS is still limited. Currently, only the mobile crisis team can take people in for psychiatric evaluations. But it is in the process of unionizing and trying to be less of a temporary fix.
I think just the nature of jobs, the nature of institutions sometimes is that you don't have that clear channel of feedback and communication. And again, that's not anybody's fault. What we want is this sort of formalized way to make our voices heard, to have some power.
And ACS says its training sessions are planned for December to add to its ranks, and that means it can handle even more calls in the future.
Hello.
Oh,
A
no.
weekly economic snapshot.
Give me 1 second. Sorry about that. YouTube loves to play and play. Okay, I'm now not sharing anymore. Great. So after voters viewed that segment, their support for creating a community safety department spiked all the way up to 88%, which again, numbers we rarely see in the public safety context. So I don't want to overstate our findings at all, because as folks understand, public safety is a really complicated and nuanced topic, but our results suggest that the more voters learn about community safety departments, the more they support them and the more they want to see these teams of responders helping people in their communities. Next slide, please. So in addition to figuring out voters' support for community safety departments, we also wanted to know what roles people thought a community safety department should fill. We wanted to figure out whether voters liked each of the individual functions that they serve. We asked about 5 separate functions, and the bottom line is they love them all. All of these programs are popular. 89% support a team from a community safety department responding to mental health crises. 89% also support proactive outreach to people who are homeless. 85% support teams from a community safety department going out to a person's home after an overdose within 72 hours to help set up treatment. And this includes things like helping with insurance and helping with transportation to really get that person into treatment and ready to go. 84% support teams from a community safety department picking up drug paraphernalia in cities to make sure that public spaces are safe and clean. And 83% support providing a highly visible uniform presence at the street level to deter crime, like safety ambassadors and transit ambassadors are doing in places all around the country already. So I don't want to overstate the difference between the 83% and the 89%. They're all over 80%, and they're really overwhelmingly popular. Next slide, please. So if you turn on the TV news or you go on social media, you'll often see these reports of chaos and disorder and crime. There are these videos of people blocking doorways, people passed out. And so it contributes to not only a public safety problem, but also a perception that there's disorder and cities just aren't safe to go into, to be in part of. And so what we did was we wanted to know if voters thought that community safety departments would help. And overwhelmingly, they did. 76% agreed my community would be safer if we had a community safety department. And 72% said, agreed, my city would be more orderly if we had a community safety department. Now, this was a forced choice. We asked voters to either agree or disagree with the following statements. But you can see that voters feel like this would be a solution to a really common everyday perception that their cities aren't safe and their cities aren't orderly. Next slide, please. All right, we're back at Albuquerque Community Safety, which is the first community safety department in the country. Our feeling is that these departments are not only interesting and innovative, and they help a lot of people, not just these departments, but also the different teams that are launching around the country to help people and these alternative responders. So there seems to be momentum. We focused on Albuquerque, but we're hearing from leaders all around the country who are interested in enhancing public safety in their communities, and they want an actionable plan, something they can do to really build out the infrastructure. Fast forward 10 years, could there be 50 more, 100 more? We're following this very closely, and we're just excited to see what's possible. Thank you so much. All right, we are on questions. Thank you, Fablina. Okay, so we have a question from Bonnie about how can local outpatient mental health practices help more? You know, I'm not an expert when it comes to how to design these programs, but it does feel like really they can be helped and by having a greater degree of coordination with other services in the city. So if the outpatient practices, the services are in constant and regular communication with the responders that refer people to them. And then they're also in regular communication with the aftercare programs and the community services. I think that's when we see the greatest degree of success. Will the slides be made available? I'm happy to share. Absolutely. And also if anyone in this presentation has any questions at all, I'm happy to drop my email in the chat and you know, what mobile crisis, with the mobile crisis unit, what type of crisis do we see the most? You know, I don't have that data in front of me. I know that these teams formed really in reaction to police being the inappropriate response for active mental health crises. And so, but I don't have the specific data on what exact types of calls they're fielding. Awesome. Thanks for your feedback. Oh, Vanessa, this is a great question. So Vanessa wanted to know about the different qualifications and certifications that Albuquerque Community Safety requires. I don't know the specific titles, but I did just learn that Albuquerque, so what they do is they have cohorts, and the cohorts kind of go through a training program, just like police go through police academy. And they just graduated a cohort of, I think, 13 new responders. And what they're really trying to do is trying to create a new field of, like, a new profession, really. They're building a new profession of qualified crisis responders. And so I wouldn't be able to say the exact titles that they're looking for, the exact qualifications, but I do know that they run an in-house training program like akin to the police academy. And it's several months long. They have a big graduation. The mayor attends, and it's just a really positive thing. So Albuquerque Community Safety is not dependent. It's on the law enforcement budget. It is a separate pot of money. It is part of the city charter that it should be funded as a co-equal department. But as far as I understand, the police department's budget was left alone, which you can see the police chief in the video was really pleased with Albuquerque Community Safety and really happy to preserve police capacity for the kinds of calls that police are best equipped to handle. All right. Oh, sure. As far as the training program, I can definitely link you to some articles about the training program. I was really happy to read about those. Are some of them connected with state law or code? I don't know about state law. I know Albuquerque made it a part of their city charter to establish the community safety department and also to fund it and to establish the status as a co-equal department to the police. So I'm not sure on the state level. That would be very interesting to follow. I haven't seen it yet, as far as I know. To what extent were people aware of alternative public safety initiatives such as violence intervention or behavioral health crisis response teams that the community safety department would house? Well, that local news clip that I played was just one of many that were going around. Albuquerque Community Safety, made a big splash when it launched, and it was regularly reported on in the local print media and the local TV media. So I have a feeling that the community in Albuquerque is fairly familiar with this development and what's happening. But it really is an ongoing process. And part of the way people learn is that they call for help and they learn that they have options just beyond police and fire. So the call process, are people calling a hotline, or are the police directing the calls? No. So in many of the places we talked about, particularly, I can speak to Austin because we conducted an interview with one of the leaders at the Austin's MCOT program. But no, the police are not directing the calls. There is a centralized dispatch center, and the person from the dispatch center is receiving the intake and making a determination as to the appropriate agency. And what are some problems that we've encountered or seen getting interprofessional community teams together? You know, most of the teams, I would say police are very supportive of these teams. And in some occasions, it takes some time. We also interviewed Mayor Baraka from Newark about his violence intervention in Newark. And he said police were initially resistant. But when they saw that the murder rates were coming down and they saw these results in places where they really were very pessimistic about reversing crime trends, they garnered support and garnered support even from opposition. So generally speaking, I think that law enforcement doesn't want to take mental health calls. They want to do what they went to police academy to do. But in the cases where there is some initial resistance, we're frequently seeing that that they come around when the data shows up and it's really, really positive. Is the community utilizing the hotline for violence intervention? So it's not a hotline for violence intervention. It will be a centralized dispatch. So there can be 3 access points, 911, 988, or 311. And in some cities, there are even more access points, but it's not a direct hotline. It's a centralized dispatch that is able to assess the caller's call and then send the right response. So then the dispatcher would send violence intervention if that's the kind of call that was being made. I do not have the decision tree for which unit is deployed, but I believe that many of these departments actually share them. I think Austin does. So I will look at that. Let me make a note. I will look at that, and if I'm able to share it, I'd be happy to. But I do think that in some of these places, they are public. Okay, I've made a note. Oh, okay. Oh, Anne's got decision trees. Anne, that's so cool. Thank you. All right. It looks like that's it for questions. Oh, one more. So in different places, wellness checks are handled by different teams. One of the things that we are seeing more of is a greater degree of confidence sending non-police teams. When the dispatch is specifically trained to ask a number of questions and really get to the root of what's happening. So in Austin, they ask about the presence of a weapon, they ask about the presence of a threat, they ask about, do you feel safe or unsafe? And after they introduced the mental health professionals into the dispatch center, the rate of sending non-police teams increased significantly, and the confidence level also increased significantly because their process was really built out and robust. Are the intervention teams city employees? Yes, they are. They are city employees. They are government employees. We actually did some polling on that and found that voters really prefer them to be city employees who get benefits just like any other city employee. That's really what people wanted to see. And as far as I understand in most places, I do think that in some places there are nonprofits running responder services. I think in Miami, there's like a nonprofit that is running one that is completely outside of the city and is kind of on its own. The teams I'm talking about are what cities are using to expand crisis response. Oh, what are some future polls safer cities may conduct? We do run a quarterly tracking poll, so we follow a number of issues and we follow them and the change over time. We definitely stay tuned. We have a number of polls in the field. I think that we're let's see. And I am going to get back to you because I know that we have one in the field right now, and I can give you a little bit more information, but I just don't have it in front of me. So, but if any of you have suggestions for polling that you would like to see, we're really interested in making sure that our work is useful to all of you. So please send it along. You can find our contact information, safercitiesresearch.com. That's our website. And you can sign up for the newsletter. I hope you're reading it. I hope you find it useful. Yeah, we'll be in touch. Oh, Mari saved the, is shared the link. Awesome. Oh, okay. Last one I'm going to answer. Carol asked about an opportunity for peers or persons with lived experience to respond on the teams. Yes, in Albuquerque, some of the teams, they have multiple teams, but some of the teams do include peer responders. I know that's particularly the case for substance use disorders, that a peer responder with lived experience, and particularly somebody who's attended the programs that are available in the city and had good outcomes, those people often find employment in the teams as well. So there certainly are peer responders that are being included in some of the teams where appropriate. All right, that's it for me. Can't thank you all enough for listening. I really, really appreciate it. Thanks for all you're doing.
Thank you, Sara, so much for coming. We were super thrilled to have you come and present about the information. We find data and polling super exciting, and another way to really get the message across to folks that these programs are working, and they can be another branch of the first response landscape. So thank you. If you have not ever signed up for Safer Cities newsletter, it comes out every week. It's 3 things to read this week. Correct me if I'm wrong, Sara. Kind of does like a roll call of things that are happening across the country. It's fabulous, so I highly recommend signing up for it. If you are not a part of the upcoming Unlocking Democracy 3.0 learning community, so if you're joining us because you were a part of the first year or the second year, or if you are a staffer or somebody from the field, you all are free to go to jump off and enjoy the rest of your day. If you are a part of the new HBCU cohort, youth cohort, substance use cohort, or CVI cohort, we are going to take a 5-minute break. So it is 11:44 Pacific. So do your time zone math. Let's meet back here at 11:50 Pacific time, and we are going to jump into what our future holds. We're really thrilled. So see you all in a few.
Hello, welcome back from the break. Just now that we're all of our 3.0 folks are here, we can get started on introducing who we are and what we're planning on doing. Next slide, please. Okay, so we'll start with the data connections portion. So we just heard from Sara from Safer Cities, who gave us an amazing example of how data can be used to identify existing gaps, understand communities' needs, and inform solutions to further programs' goals. And she did a wonderful job of sharing it with us, all of us too, in a way that was compelling and easy to understand. Data is such a powerful tool in our work, and it doesn't need to be this big, scary concept. For example, you don't need a fancy data degree to be able to utilize its benefits. And we hope to be able to highlight this and more in our upcoming data connection sessions. No matter what your program is specifically focused on, whether it's overdose response, CBI, youth, or HBCU response, data and information is critical in ensuring that people have a place to call, someone to respond, and a place to go. And because of this, all of our cohorts will be joining this data connection learning community to learn from us, but most importantly from from each other, how to take the data that you all are already collecting and turn it into actionable, practical messaging and solution building. And our goal for these data connection sessions is to help build your organization's capacity to develop clear and actionable plans, to collect data and use it to advance your mission and strategic planning efforts, to identify the resources and key partners you need to champion your work, and promote your successes and leverage them towards sustainability. We understand that you all are coming to us with different experiences and expertise around data, and you may be at different stages of your program planning and implementation. Our sessions will be designed with this in mind and aims to meet everyone where they're at in their data journeys. And in the next few weeks, we'll be joining your one-on-one sessions with your content managers to get more clarity on your individual data expertise and needs, to help us better tailor our approach. And we hope that everyone will be able to leave these sessions with something tangible to further their program goals. Our sessions will be interactive and will provide space for you all to learn from each other and troubleshoot your issues together to help tap into all of the knowledge and expertise that's in this room right now. Next slide, please. So hopefully this all sounds exciting to you. I know that Emily Rogers, my wonderful data partner, and I are thrilled to be leading this cohort and getting to know all of you better. On the screen are the dates for our sessions. We're hosting 3 sessions total every other month starting in January. The first one will be on January 29th, and we'll cover logic models and data collection plans and how they can be leveraged for strategic planning. The second session on March 26th will be around stakeholder identification, where we'll lead a mapping activity to help you all organize who you should be sharing information and resources with. And the third session on May 28th will build on the second and cover how to tailor your messaging to match the goals and interests of your various stakeholders. Now, these session topics are not set in stone. Our goal is to make these meetings as helpful to your teams and work as possible. And as such, we want these sessions to be co-designed with you. So if you have any other topic suggestions that you'd like to see instead, please let us know and we can pivot our strategy accordingly. We'll also be holding office hours to help you all solidify and build on the concepts that we cover during the sessions on a more one-on-one level. And those will be held on our off months, one on February 26th and one on April 30th. And finally, we'll be hosting a wrap-up webinar on June 25th to tie everything together and highlight some of the data innovations and successes that you all will have achieved. We're looking forward to our first session And again, if anyone has any questions or suggestions on other things you'd like to see, please reach out to your content managers or Emily and I, and we're more than happy to connect. And with that, I'll turn it back over to Anne to introduce the rest of Unlocking Democracy 3.0.
Thanks, Kanya. I want to assure everybody in the room that Kanya, Emily, and Fablina will make data collection and data work the most fun you'll ever have. You'll never look at data the same, because what I was told when I first started doing this work is that everything you're doing is a data point. Like every conversation you're having, every cool thing that you are doing in your community or at your college campus is a data point. So I'm thrilled that Kanya, Emily, and Fablina are the work with everybody in this room on their data journeys. Okay, so who is in the room? Can we get the next slide? Oh my gosh, 32 learning communities. So we have been in partnership with CPE. This is our third year in doing Unlocking Democracy learning communities. This is our biggest roster to date. You can look across the map of the US. I know everyone's probably could be having a little bit of map anxiety, but this is a map that we should be thrilled about. So we are covering all the way from the East Coast to the West Coast of, and this is why we're all here together. Throughout the next few months, we're going to be working with our individual cohorts, and we'll be doing a little bit of independent shout out to all of those. But this is who's in the room. Like, so whether you're working on youth or working with substance use or working in CVI, there's somebody in a state near you or in your state that's doing similar work. And what we're all working towards, what our North Star for Unlocking Democracy really is alternatives to law enforcement for those folks in our communities, on our college campuses that really need support in lieu of incarceration, detainment, handcuffs, all of those types of things. So we're thrilled that you're all here. We can't wait for you to get to know each other. And we're here for you in our individual groups and broadly as well. Next slide. I'm going to turn it over to Chantel. So Chantel and I are going to be leading the substance use and overdose charge. And I am thrilled to introduce Chantel right now to give a recap or give an overview of what the future holds.
Afternoon, everyone. I hope everyone is having a wonderful day. So as we embark on our time during the next few months, we want to hear from you as to what's happening in your community, what's working in your community, such as any critical strategies that you're doing within your community to support your work. This learning community is going to be a space for collaboration, learning, and shared insights. Together, we want to explore best practices, innovative solutions to help address the overdose crisis. We are looking forward to all the discussions that we'll have, all the peer connections that we will be making, knowledge sharing, and the collective impact that we will have in advancing this vital work. Over the next few weeks, we'll be connecting with you all to get to know you and your programs better. This will help us to develop any content that we have in mind for our learning journey. Now, I'm going to turn it over to our CVI team for a brief intro of their learning community.
Hi, everyone. My name is Ciaran Edmondson, and I am a Policy Research Associate here at the Center for Policing Equity. And I'm also one of your content managers for the CVI learning community. And I just want to welcome you all and let you know that we're super excited to be kicking this learning community off. Community Violence Intervention and Prevention Initiatives, also known as CVI-PI, is about addressing violence at its root and using community-based approaches to reduce and prevent violence in a way that is sustainable, but also really responsive to local needs. This work is centered around relationships, trust, and the idea that those closest to the challenges are also closest to the solutions. So I just want to give a super warm shout out to all the CVI teams participating with us. We have lots of amazing teams, and we have a super well-rounded group of violence interventionist and preventionist. We have some offices of violence prevention, and we also have some hospital-based violence intervention programs. So super excited to be working with you all. And now I will pass it over to your other content manager, Ileana Mendoza.
Thanks, Ciaran. I echo exactly what Ciaran said. We're super excited to be with you all. So over the coming months for the CVI learning community, we'll focus on building an ecosystem that supports CVI effectively. This means fostering connections and partnerships, ensuring sustainable funding, and creating a strong narrative that highlights the positive impacts of CVI efforts on safety and community well-being. Each of these pieces is critical in building long-term support and making a real impact in the communities that you serve. In the weeks ahead, we'll be setting up one-on-one meetings with each of you to dive into your unique. These conversations will help us shape our work together. We are looking forward to learning from you all and seeing how we can support each other in this essential work. Thanks for being here and bringing your dedication to CVI. I will now pass it over to our friends from HBCU.
So good afternoon, everyone. My name is Sean Eldridge, and I serve as the Director of Law Enforcement Initiatives at the Center for Policing Equity. I'm especially honored to be here today as I am a proud HBCU alum from the real HU, Hampton University, which makes this cohort particularly meaningful for me. This is an exciting moment as we welcome our first HBCU focused cohort. Last year, we spoke with a group dedicated to enhancing crisis response on college campuses. However, we felt a strong need to tailor this content specifically to meet the unique needs of HBCUs and to invest directly in Black students and communities. We'll be working with Bowie State University, that other HU, Howard University, Tennessee State University, Tuskegee University, and Xavier University. You just met Ciaran, but Ciaran Edmondson and Melissa McKee, our talented content managers, will be working closely with you throughout this program. And I'd like to also introduce Brittany Kosciuszko-Lee, who is the Director of Community Engagement at CPE. We're all here to support you in any way possible. Our goal for these sessions is to make them responsive and co-design with your input. Ciaran and Melissa are eager to tap into your expertise, helping you expand and strengthen your crisis response systems in ways that best serve your campus community. So please keep an eye out for an invitation to schedule a one-on-one with Ciaran and Melissa soon. We all look forward to working closely with each of you on this important initiative. Thank you. And I believe I am passing it to Marie.
Oh, thank you so much, Sean. Wow, I could listen to you talk all day, Sean. You have such a great calming voice. My name is Mari, everyone, Mari Bayer. I am a project manager at the Council of State Governments Justice Center. I work on the CRP team. However, for a short amount of time in my life, because my education and training is in clinical forensic psychology, I worked very closely with youth and families who were involved in various systems, sometimes all at once. So this youth crisis response learning community is very near and dear to my heart. I am joined as a co-content manager by Michelle Fernando. We will be tag teaming, leading and facilitating the youth crisis response learning community, which is going to really be focused on crisis, mobile crisis response, and improving those responses for children, youth, and young adults. What I mean by that is we're going to all work together. As you can see on this map, we have some really heavy hitters from the community responder space. I see Durham's in the room, Austin, St. Louis, Aurora, Amherst is joining us, as well as people who are already heavy hitters in the youth service and best practices space. Like we have people from Iowa City, and Eugene Hoots is here. So we're all going to come together. We are all going to work together. Michelle and I can facilitate connections and resources and information collaboration, but really you all are here as experts coming together to really support one another in your strengths, to seek support from one another as you seek to grow in your various areas. So this is going to be a very collaborative learning community. As Chantel said, and as the other content managers said, we really want this to be a co-created learning community to meet you all where you are at in the moment for your program. So what we're going to be doing after this big launch, we'll be reaching out to you all to be scheduling individual meetings to really learn, what are you most proud of about your program? What are your current biggest challenges related to youth responses? And what do you feel like you could teach if you showed up as the expert speaker? That way we can really build sessions and create the most valuable experience for everyone. So you can walk away with some concrete next steps, some usable resources, as well as some new connections and friends, hopefully. So to get us started on this track, all of us together, kind of coming back around to what Kanya was just talking about, what all of these intros were just talking about. Melissa, you can go to the next slide if you'd like. We're really going to get our creative juices going here. Here's the interactive part. We've been warning you this whole event so you didn't just get, blindsided by a breakout group. Don't worry, we're not going into breakout groups, but we don't want you to run away. So you've been prepared. We're doing some interactive components, but it is really important. This isn't just some cheesy excuse me, I am just reposting the link. This isn't some cheesy effort to get people to participate. This really is something to get you to start considering about your programs and about where you are currently so that you can really talk to us about what you need in this learning community. So I'm going to start out by asking you all in the room, what is the primary goal of your program? Because much like what Anne and Kanya were saying, we all have very similar primary goals, despite us saying that we work in different spaces and despite being based in many of us different places. So go ahead, if you haven't already, scan that QR code with your phone. I prefer using Slido on my phone. I think it's easier, but if you're on a desktop computer or a laptop computer, feel free to click the link I just posted in the chat, jump on and join it. You can respond anonymously or you can respond with your name. It really doesn't matter. This isn't going to be a public thing. It's just so we know who's in the room and what we're dedicated to work on. So I see people coming in. We have violence reduction. We have to reduce overdoses and increase knowledge of SUD and support of those in needs. Supporting students, yes. And I think students can range from those college students all the way down to the youngins in kindergarten. We know that schools can be one of the biggest reporters of crises for children, youth, and young adults across the board to send the most appropriate response to any and all calls in crisis. We would like to effectively collaborate. Absolutely. Expanding access to services. Yes. Grow our agency capacity. Yes, yes, and yes. And increase community support, mental health services. Absolutely. Building community connection. I just keep seeing that community engagement, that community connection coming in again and again. Increased access, decreased stigma. Yes, that is popping up again and again. Absolutely. That is across the board for all of us, I imagine. Mental health, emotional, and academic support. Yes, for sure. We'll go on a little bit longer and then we'll jump to our next question. I see Stacy in the chat also said providing psychological services to students and training for future psychologists in a training program. Yes. You're only as helped as the people who are providing the help, right? So we have to make sure that the people who are providing that help and responding are well equipped and confident and competent in providing the responses that we are hoping that they provide. Sending the most appropriate response for folks in crisis, yes. Advancing education and employment, 100%. Thank you all so much. Let's keep this chugging along. Let's go on to our next question to see where we're all at. As you can see, where this is going. We're all a lot more similar in our programs than we think. So what do you believe is your program's biggest accomplishment so far? Doesn't matter where you are in the implementation process. It could even just be like thinking of this program, realizing that there is a need, convincing someone that there is a need, all the way to we've served thousands of people. We've created new departments, you name it. What do you think, in your experience, is the biggest accomplishment your program has achieved? School safe passage, starting, yes, absolutely. Decreasing mental health stigma among youth, yes. That we're still here, yes. Sustainment, yes. Expansion across the state of deflection teams, absolutely. It's that expansion, that data capacity, the ability to share information and bring people to the table. It's so challenging. You get people to show up for one meeting, but sometimes they drop off after a while. Yes, yes, and yes. Realizing the need and creating a network, absolutely. The first step to move from talking to action, yes. Receiving a grant to start law enforcement diversion programs, 100%. Coordination with first responders like law enforcement and EMS. Someone's created a position to offer outpatient, inpatient, and sober living services directly to members of the community. Good for you. Wow. That somewhere to go is such a tricky subject when we're focused on that crisis response, that someone to call, someone to respond most times. But really, these teams, you all as a program, need somewhere to go. And I know that there are many teams in this room who have taken on that responsibility of creating a place to go, a case management program, and also outpatient, inpatient treatment as well. Thank you. Expanding partnerships. Partnerships are so critical. And like I said, keeping people at the table, keeping people invested and active can be so challenging at times. Working with dispatch. Dispatch is such a critical partner. Police as well, diverting mental health calls. Trauma response training, crisis intervention training, knowledge building, knowledge sharing to reduce that stigma and to increase the capacity and competency and confidence of all responders. Absolutely. Receiving grants, let me tell you, grant writing is so stressful and so much work to maintain all the way through to the finish line. And then there's such a long waiting period. Grants, grants, grants. That's awesome. Good for you. Making our counseling and wellness office more visible. Yeah. Yes, distributing grants. Absolutely. So let's pivot a little bit, because learning communities are about celebrating, sharing, but also asking for support and receiving it. So let's pivot a little bit and talk about what you believe the biggest challenge for your program is currently. What is that thing that you kind of shudder and cringe away from, or go, oh, yeah, we got to figure that out? What is it right now? Again, it can be small, it can be big, it can be theoretical, it can be concrete, can be my left desk drawer is so squeaky that it interrupts my neighbors' meetings, anything at all. Finding qualified and dedicated staff, absolutely. And that's something that we're seeing time and time again. That's why we're hosting that webinar on how programs can partner and are partnering with local colleges. So please join that and start participating in that conversation as well. Sustainability, adequate funding. Funding's huge. A direction and process for starting community outreach, funding, yes. Balancing policy and procedure with getting folks the help they need quickly. Yes, it's that balancing the planning and making sure you're thoughtful with getting people the help they need right now. Data and case management software. Oh my gosh, I think that there are plenty of people in this room that can support you with that, as including us. Eroded trust in public safety. That healing mechanism, while providing services and not being labeled as the band-aid to past harms, but being the partner that helps with the healing process, it can be such a challenging balancing act. How to create a pathway from jails to inpatient addictions treatment to sober living to create easier reintegration. Yes, absolutely. That is a constant challenge. Funding and self-care and wellness is huge. We have talked about it at CSG multiple times, had to ask the experts on it. It is definitely something that is so critical in a profession that is so high stress, so high movement. You want to keep them safe, secure, and well so that they can put that back out into the world. Leadership buy-in, yeah, keeping people all the way up, down, and across the ladder invested, interested, and active in this work can be so challenging. Effective team communication, yes, absolutely. And there's not a doubt in my mind that there are teams in this room nodding to all of the challenges that everyone is posting right now. But the best part of this is that there are also people in this room who went, oh, yes, I remember when that was a challenge. and they have found a workaround. They have found a process to overcome it, or even to just manage it on a daily basis. So that's why these learning communities are critical. All right, one more question. Melissa, you can go on to the next one, please. Okay, now that we've wrapped our heads around what people in the room are experiencing as far as the super big highs and celebration, the goals, the focus, the vision, and also the challenges and the hurdles, what about this learning community? One made you sign up. You know, you read the application, you took the time to fill out the application, you accepted it, and you showed up in the room today. What is it that excites you most? It can be what you want to get out of it, or even just whatever it was that jazzed you and lit that fire. Collaborating and sharing and learning about new resources, sharing strategies, learning from different communities. Community of peers, yes. Yes, the brilliance in the room. Gaining knowledge and connection. Connection is key. We don't want reinventing the wheel and suffering in silence, right? The number of resources available, sharing and learning, networking, interventions, evidence-based practices, and connections for youth, yes. Sharing with people across the country, networking, learning from others, opportunities to collaborate with other organizations, innovation and inspiration. Yes, yes, and yes, absolutely. These are all here in this room right now. I've seen what a past participant has learned and how the program has grown. I'm so happy to hear that. That's super validating. Absolutely. And yes, it happens again and again because really these teams that are in the room here want to support one another. We all want each other to succeed. I enjoy learning and discovering ideas that may be useful for my organization. Yes. Absolutely. It looks like we're slowing down. But I took down, so I'm an envelope writer. Just thinking about the questions that we were even asking Sara at the end of her presentation, you know, can you share a call protocol? How do you get stakeholders to the table? How do you get them to show up? Were people interested? Were people invested? And how did you get them there? How is CVI? How are these teams getting called out? Do they have a hotline? Are they going out through 911, 988, 311 dispatch? What are these training academies? How do you train people? What are those protocols and programs in place? How do you get peers and other types of professionals involved in these responses, involved in the leadership of these programs and the design of these programs and in the marketing of these programs? What different types of responders are there? Are there different levels with different responsibilities? Do you have entirely different teams under one department responding to different call types and needs? How do you get provider partnerships and that connection to the somewhere to go side of this, the case management side of this? And like I said, some of the teams in the room had to take on that burden from themselves and to create a little pocket, a little team that took that on. And all of these questions that came to Sara, I was sitting and thinking about all of the people who are in the room right now across the different learning community teams. And I know people by name that are sitting here, these teams that know the answer to the questions that I wrote down while you were asking Sara. I know that there are people in this room, like I said, that have overcome those challenges, that are celebrating the same successes. And it can be one of the community responder teams in the room. It can be one of the CVI teams in the room, one of the overdose SUTD, you know, the HBCUs. Oh my gosh, the colleges in the room. If you want to talk about innovation and resourcefulness to serve communities inside and outside of college, those are the teams for us. So that's why we're getting together in the data connections all together to share your innovations, to collaborate with one another, to really create that networking and peer connections across learning communities. But then we're going to break out because there's a reason why you applied to the certain topics of these learning communities. So you want to focus on substance and overdose reduction. You want to focus on community violence intervention and youth responses to crisis at HBCUs. So there's a reason you applied to these topics, and we're going to focus on those topics. But as you can see, the people who are within your cohort of the learning communities have these resources, have these knowledge bases. I'm sure, I wish I could see all your faces. I'm sure there were tons of nods. And yes, we've been there. Yes, we have that protocol. Yes, we do that training academy. They're here. So what we're going to do, you can probably go to the next slide now, Melissa. I think we have some contact information for you. This is the contact information for all of the content managers of the different learning communities. So you can get in contact with any of us. If you have questions, if you're in the CVI group, but you have a question about youth, reach out. If vice versa, if you have something about youth that you want to share, please, please, please reach out. We're happy to make that connection and make sure that that communication happens. So you have our contact information, and what's going to happen next is you are going to hear from your content managers about the various sessions that we have set up. You should be getting some calendar invitations, so they're blocked off on your calendar. It is essential that at least one person from your teams is attending each of these sessions. So we have continuity, consistency, and the ability to build upon each session with each other and really to create those close connections in the learning community. So please, please, please take the time to have at least one person that's a constant, but also invite other people depending on the topic. See if people, see if your contact managers are open to more people joining. I know the youth one, we 100% welcome other team members as you see fit, as you think they would be interested. So jump on board with that as well. You'll be, like I said, you'll be getting those calendar invitations about the sessions, but you'll also be hearing from your content managers again to meet up, to learn more about you all individually, where you are at right now, and how we can co-create a learning community together, what you can share, what you want to be shared with you, and go from there. And we're going to create a roster of contacts. So not only are you going to have access to all of the content managers across two incredible organizations, these heavy hitters being CSG Justice Center and CPE, you are going to have the contact information of the people across the different learning communities so that you all, which is the main goal, can connect with one another, can engage with one another and support one another. We're happy to be the go-between. We love being the friendship maker, but also you are welcome to engage with each other as you see fit. So look out for those things. Please be open and engage and participate in this learning community, because what you put in, I promise you, is what you get out of each and every one of these sessions. I know it's a big commitment, but I promise you the value that you're going to take out of this is boundless. So with that, I am looking at the time, and we love giving people time back in their day. I'm going to pause for a second, see if Anne or Ileana or any of the other panelists on this webinar have any final thoughts, any final announcements, but I think 5 minutes back in the day is pretty good for a 90-minute webinar. All right, I'm not hearing anything from anyone. I am looking at the chat. It looks like Anne and Ileana and Sierra have come in to say thank you. Yes, we are all so, so, so excited. Again, please reach out for anything at all. And with that, I hope you all have a fantastic day.